Hello, my name is Jessica with Mama Shakti Prenatal. Today we are going to review 5 gentle infant massage techniques that you can do with your newborn, especially if you're noticing that they may have some body tension or torticollis with their head bent to one side. Now these are great to do at home, but it's also really important to follow up with a pediatric provider like a pediatric chiropractor or a pediatric physical therapist who can help address some of the reasons that your newborn might be holding some tension in their body after birth. But these you can do in the meantime before you get an appointment in with that pediatric provider. So these are 5 techniques that anybody can do. And remember, when you are massaging your newborn, you want to use very gentle pressure, and we're not pressing really hard or tugging or doing anything to compromise their joints. And if at any time it seems like they are in pain and they are just really not liking it, it's best to stop. So the first thing that we're going to do is we're going to lay our infant on their back, and we're going to gently pull and massage their leg down. So we're not pulling with any great force, just a little bit to stretch the muscles in those legs and kind of get the pelvis moving a little bit. So it's just 5 strokes down from the hip down to the foot. Very good. And we do that on both sides. So just a gentle stretch down the leg from the hip to the foot 5 times. Very nice. And you just lay a hand gently on their chest to stabilize them. Then I like to do a gentle little movement like this to help kind of settle their nervous system. It's just a really gentle rocking back and forth. There's no real crazy movement here. We're just kind of allowing their nervous system to receive the massage. Very nice. And then we're going to do that same movement to their arms, starting at the shoulder and then just gently, very gently pulling down to the fingertips. And you can press your thumb into their palm as you come down, and hand down from shoulder to palm, and just a little gentle squeeze in the palm as you come down 5 times on that arm, and then 5 times on the other. So it just looks like this. A gentle massage down, a little thumb in the palm as you come down. Very nice. 5 times on both arms. And then we're going to give them a little stretch. So this is going to stretch their SCM muscles. And if you notice that your newborn is really kind of tilting their head to one side, this can help stretch those SCM muscles in the front of their neck. You're going to take your hands and you're going to use your 3 fingers to support their neck, and your pinkies will come right under their shoulder blades. Your thumbs are right on their breastbone. And this is just a very gentle stretch. So you're going to lift them up so their head kind of falls back. You are only lifting about an inch or 2 off of your pillow or your bed. So it's almost like a very gentle heart opener or very gentle back bend. And we're just letting their head kind of go back like this. And they're only coming up a little bit off of the table or whatever you're massaging them on. And then we relax them, and you're not pressing here either. You're just allowing the weight of the head to gently dangle and stretch the front of the neck. And then relax. And I hold each one of these for a breath. So inhale, exhale, and I do that 3 times. All right, so moving on, we're going to move on to the face. And we're going to massage from that soft spot right under the chin where you feel your chin bone, and then it gets really soft right here. And we're just going to go down and out to the side of the neck with both fingers like a V. And we're going to do that 10 times. So really gentle pressure. You do not want to press too hard because it could make the baby choke or it could be uncomfortable. So you're just gently pressing with your fingers from here down to here 10 times. Very nice. And then the last move that we're going to do is a sinus massage. So we start from right here on the inner canthus of the eye and just kind of rub down here to the outer corner of the mouth, almost like a J. So we start, remember not to get too close to their eyes. You don't want to accidentally poke them in the eye. So if you're feeling like you don't feel very comfortable with getting that close to their eye, just start a little bit below for safety. And we're going to do this 10 times. Now remember, it's always important to wash your hands before you touch your newborn. You have nice clean hands, and you shouldn't need any oil or anything. If you do, a little bit of coconut oil is a lovely thing to use. And we do 10 times from the inner canthus of the eye to right out to the outer corner of the mouth, like that. Now, my name is Jessica with Mama Shakti Prenatal. I studied traditional Chinese medicine in grad school and was certified in Pediatric Chiropractor, which is an infant massage. And I also have a teacher named Hang Ma in Tampa Bay, Florida, with Latch and Touch, who does wonderful TCM, traditional Chinese medicine techniques for pregnancy, postpartum, and pediatrics. So if you have any questions, drop them below and I'll share all of my resources with you. Thank you so much. Have a great day.